So I'll talk about the differences between midpoint of inguinal ligament and mid-inguinal point. Firstly, I would like to list down few important anatomical landmarks in the pelvic bone. So that is the pubic tubercle, anterior inferior iliac spine, anterior superior iliac spine. I'll draw the same on the opposite side as well. Pubic tubercle, anterior inferior iliac spine, and anterior superior iliac spine. So this is the rough diagram, and I'll complete the pelvic bone on both sides. Both sides. So in between the pelvic bone, we have pubic symphysis. We have pubic symphysis. So I'll quickly list down the anatomical landmarks that we drew. The first one is pubic symphysis. Pubic symphysis. Second one is your pubic tubercle. And the third anatomical landmark is anterior superior iliac spine. The fourth important landmark is inguinal ligament, which extends from pubic tubercle to ASIS, which extends from pubic tubercle to ASIS, something like that. The fifth landmark is midpoint of inguinal ligament. The literal meaning of midpoint is center of something, right? So the center of inguinal ligament is midpoint of inguinal ligament, and that would be approximately somewhere here. Then what about mid-inguinal point? So to know about mid-inguinal point, we have to draw an imaginary line that extends from, we have to draw an imaginary line that extends from ASIS, that extends from ASIS to pubic symphysis, that extends from ASIS to pubic symphysis like this. So the midpoint of that imaginary line that we drew is your mid-inguinal point, is your mid-inguinal point. So the fourth important landmark is inguinal ligament. Fifth is midpoint of inguinal ligament. And sixth landmark is mid-inguinal point. Mid-inguinal point. We can see the same in this image as well. This is ASIS. This is ASIS. This is pubic tubercle. This is pubic tubercle. And this is your pubic symphysis. This is your pubic symphysis. So inguinal ligament extends from ASIS to pubic tubercle, ASIS to pubic tubercle, and the imaginary line will extend from ASIS to pubic symphysis, ASIS to pubic symphysis. And this is the midpoint of inguinal ligament, and somewhere here would be mid-inguinal point. Here you can see midpoint of inguinal ligament is slightly lateral to the mid-inguinal point. So what is the clinical significance in knowing what is mid-inguinal point and what is midpoint of inguinal ligament? For that, I have to draw abdominal aorta. I have to draw abdominal aorta. Abdominal aorta splits into common iliac artery on both sides. This common iliac artery in turn gives off external iliac artery and internal iliac artery. External iliac artery and internal iliac artery. This external iliac artery runs down like this. External iliac artery runs down like this, passes below the inguinal ligament to enter into lower limb, passes below the inguinal ligament to enter into lower limb, and becomes femoral artery. Femoral artery supplies lower limb, right? So I'll draw the same on the opposite side as well. The external iliac artery runs below the inguinal ligament to enter into lower limb to become femoral artery. I'll quickly list down the anatomical landmarks. Abdominal aorta gives off common iliac artery. Common iliac in turn gives off external iliac artery and internal iliac artery. Internal iliac artery. This external iliac artery passes below inguinal ligament to become femoral artery. Besides femoral artery, we have femoral vein and femoral nerve running along femoral artery. We have femoral vein and femoral nerve. The femoral vein and femoral nerve are arranged in the sequence of femoral vein, femoral artery, and femoral nerve from medial to lateral. From medial to lateral. This is your medial side, this is your lateral side. So what is the significance of knowing mid-inguinal point? As I told you, abdominal aorta gives of common iliac artery in both sides. Common iliac artery gives of external iliac artery and internal iliac artery. This external iliac artery, once it passes below the inguinal ligament, becomes femoral artery. Becomes femoral artery. In this picture, you can see a gentleman or a lady is palpating for femoral artery. Is palpating for femoral artery. Arteries carry pulsations throughout the body, but we can feel for these pulsations only at certain points, right? And why is that? This is because arteries usually runs deep. So when they come superficially, we can feel for these pulsations. So one of the areas where we can feel for the pulsation is at mid-inguinal point, and we can feel for femoral artery pulsation. But against which structure are we feeling for the femoral artery pulsation? As you can see in this image, this is femur and this is head of femur. This is head of femur. So we are palpating for femoral artery pulsation at mid-inguinal point against head of femur, against head of femur. So one of the clinical significance of knowing mid-inguinal point is we can feel for femoral artery pulsation against head of femur, against head of femur. Another important clinical significance of knowing mid-inguinal point is to locate deep inguinal ring. Deep inguinal ring is a deficiency. Deep inguinal ring is a deficiency in fascia transversalis that is located exactly above mid-inguinal point, half an inch above mid-inguinal point, half an inch above mid-inguinal point. So at mid-inguinal point, we have femoral artery against head of femur, and half an inch above mid-inguinal point, we can locate deep inguinal ring. We can locate deep inguinal ring. So what about midpoint of inguinal ligament? What about midpoint of inguinal ligament? So this is your midpoint of inguinal ligament, and this is your mid-inguinal point. As you can see in this image, femoral nerve lies beneath midpoint of inguinal ligament. Femoral nerve lies beneath midpoint of inguinal ligament. So in this image, everything is seen very clearly. So this is the inguinal ligament, and this is ASIS, pubic tubercle, and somewhere here would be pubic symphysis. Somewhere here would be pubic symphysis. We can clearly see vein structures here: femoral vein, femoral artery, and femoral nerve, arranged from medial to lateral, and exactly at midpoint of inguinal ligament, beneath the inguinal midpoint of inguinal ligament, you can see femoral nerve. You can see femoral nerve. And somewhere here would be mid-inguinal point where you can feel for femoral artery pulsation. And that is all you need to know about midpoint of inguinal ligament and mid-inguinal point. Thank you.